Hello and welcome to the Ascend Health Show. I'm Nick Angelis. I'm one of the owners of Ascend Health Center and I'm a nurse anesthetist. And I'm here with Casey Gigonco. Did I pronounce it right this time?
Giconio.
Oh,
close.
so close.
So close. It's all right. I'm used to it.
She's a nurse and a death doula, which I've met death doulas before, but probably all of you are like, wait, what? What did you just say? So why don't you explain to us what a death doula is?
Yeah, absolutely. I'd love to. So people have more commonly heard of birthing doulas, and birthing doulas kind of help somebody labor into this world. Mm-hmm. So a death doula does the similar thing, just on the opposite end of life. So I help my clients to safely and comfortably labor out of this world.
Oh, wow. That's really neat. And what this has to do with mental health and Ascend Health Center, not that all of our guests have anything to do with my clinic, honestly, is that a lot of times the ketamine infusions that we do is almost like a near-death experience. And there's a lot of research, psychedelics and ketamine specifically too, of how these substances can also help you, as you said, labor out of this world. Because no one really likes to talk about death. But it's such an important topic in our society for our own mental health, for our spiritual health. The American way is like, let's just work really hard, make some money, ignore death until it comes, and die in an ICU after 4 weeks and $345,000.
Yeah, I know, you're absolutely right. So at some point along the way, right, humans have been around for a long, long time, but at some point along the way, this idea that dying is a medical experience is what came along, but really it's more of a human experience, mm-hmm. right? So for such a long time, people thought that, to die, you would need to be in the hospital or something like that. But it just doesn't have to be that way. It can be so much different, and it can be so much better and so much more personal and beautiful and planned. Mm-hmm. And like you said, nobody wants to talk about death, right? And I find that people just let it happen to them, because we don't want to talk about it and we don't want to plan for it. So death just happens to people, and it happens how it happens, but it can happen so much better if we do talk about it, and if we do plan about it, and if we are educated about what could happen and how it could happen and how we could what kind of interventions you would put into place in certain scenarios. Things
right.
can just go so much more smoothly.
Mm-hmm.
So for me, I like to rattle everybody's cage and make them think about death and talk about death all the time, all aspects of death, whether it's planning for your death or what your death could look like, or, the use of psychedelics in relation to end of life and things mm-hmm. like that. So
yeah, absolutely, because it's going to happen. Sorry that we just burst everyone's bubble here, but you're going to die. So you might as well plan for it, because there's a lot of things in life that happened that maybe didn't need to happen, but they did because you didn't talk about it, whether that's a divorce or job loss, bankruptcy. There's a lot of things that, like, after the fact, people are like, oh, if I'd only talked about it or thought about it or had a plan in place. And so this is similar, except for the fact that it's going to happen, unlike all the other awful things I mentioned. But and even good things. Sometimes people just stumble into it, but it's like, you know what? This could have been even better had I planned for it. You think of lottery winners where a lot of times they go bankrupt, and it's something like, well, this was a good thing, but again, because there wasn't a preparation for this, it didn't work out right.
Yeah.
So what we're talking about is a good death, basically.
Yeah, so honestly, what I like to say is that I help people die better, and that's really what I do. When things are perfectly planned, and when people do think about and know about and understand what could happen at the end, we're able to plan it to be a truly beautiful experience. And I can give you a little bit of an example, right? So people sometimes don't realize that you don't usually just die one day. There is a small percentage of the people in the world that do die that way.
Right.
But for the most of us, it is a labor out of life, and your body takes a period of time to shut down, and that period of time can be 5 to 14 days even. But during that time, you're usually not able to speak for yourself mm-hmm. or even move yourself around. You're kind of just laying there while your body does its thing. So for me, I like to make people think about this, like, what would you like that to look like? So if you were laying in bed for 5 days, for the last 5 days of your life, and you couldn't communicate with me and you couldn't really move around, like, what could we do to make that a beautiful experience for you? So I love to make people think about how we can make it a sensory experience. So while people usually aren't able to communicate, it is my belief that they still are able to experience the things that are happening around them, the smells, the sounds, the feels, the touches, things like that.
Right.
So I like to make people think about that, right? What are your favorite smells? What kind of smells can I fill the room with in the last days of your life that'll make you feel calm and comfortable? Is it lavender? People love lavender. Is it chocolate chip cookies? Because if so, I'm going to bake chocolate chip cookies for everyone, you know? I can really make it just a truly beautiful experience instead of it being a really chaotic, stressful experience because nobody knows what's going on and everybody's nervous and scared.
Yeah, and the thing too is, so what I see in our practice, obviously being a nurse anesthetist, I'm more on the ketamine side as opposed to our counselors or our psychiatrists, but it still is, there's so much trauma around death. A lot of times people are reliving the death of loved ones. We have a lot of veterans, sometimes they're reliving some of their war experiences. And death is traumatic regardless a lot of times. There is loss, there is grief, but if we can make that a more gentle passing, then it's not only for the person, it's not only for your patient, it's for everyone that they interact with, so that they don't carry, they'll still carry the grief, but again, they don't carry the traumatic loss as heavily, knowing that this went the way that we prepared for it to go.
Yeah, and you know, part of what I do as a death doula, so I'm not a counselor, but there is a little bit of, I don't know if it's counseling or just talking through things that happens, but for me, like you said, there is sometimes a lot of trauma and regret and grief and guilt and all of these things that people will keep down inside. And I believe that if you can get those things up and out, that sometimes people can die more comfortably because they aren't holding on to that stuff. So there is a little bit of that aspect to it as well, where, you know, in talking to people and learning about them and how they feel and their diagnosis and their future and their life, I'm usually able to also kind of identify that, you know, if there's something else, you know, a little something where they're sensitive around, you know, it's good to kind of get that out and talk about it. And people are actually, you know, sometimes family members will bring something up, like this is a sore subject, they're never going to want to talk to you about it. And then it's funny, I won't even really have to bring it up. It'll just kind of come out organically and they will want to talk about it. So I think that people find me, I'm not family, you know, I'm a different person and I don't hold judgment and I haven't known them their whole life. So I think that sometimes it's a little easier for people to get that stuff out when they're talking to me.
Because we often think of that as a positive way, like Grandma held on until Aunt Carol could come over. But you're saying sometimes it is that somebody needs to get something off their chest before they can die peacefully.
Yeah, and sometimes if they don't, the death maybe won't be so peaceful, is why I like to really encourage people to get that out. I mean, if you're holding on to a lot of anger and stress and things inside of you, then sometimes your death can kind of resemble that as well. It can just be an uncomfortable, agitated type death. So I really love to, you know, send people into that active dying stage in a beautiful, healthy space in their head, because that's going to help their body die more comfortably.
Right, and I see that too in the hospital. So I've been a cardiothoracic nurse, neurointensive care nurse. I've been a nurse anesthetist for about 13 years now. I've done a lot of trauma cases, and even when someone is dying suddenly and we're trying everything to save them, that death still is different often depending on what's going on.
Yeah.
And I think one thing that's important too, because I want to discuss a lot of these awkward spiritual issues too, is that a lot of times death isn't fair. You know, as a nurse anesthetist, there's been plenty of times where there's a prayer chain of 500 people going for somebody that should really make it through surgery. Nope, they died under my hands doing the anesthesia.
Right.
And there's other cases where, you know, it's a child alone and somehow they miraculously make it and nobody even knows their name.
Right.
So we have to remember too that death isn't a time to figure out what makes sense. Is God just? What's going on? It often is what it is, and we have to accept it as what it is, because when we put our own feelings into it, I mean, that's, again, I mentioned the arbitrary $325,000 in the ICU.
Right.
A lot of times, like, no, I know you haven't settled these things, but it's time for them to go.
Right.
You know, we don't need them on 17 different drips, keeping their heart alive as everything else dies.
Right, slowly, yeah. I like to say, I actually have heard this before, it's not like I made this up, but death doesn't discriminate, so that's
We'll give you credit, nobody knows.
I don't want to steal credit, but yeah, death truly doesn't discriminate, right? So, you know, I'm a death doula, and so a lot of people meet me and they're like, ooh, I don't need a death doula, but there's a lot of stuff that I can teach you, because, you know, at any age, you have no idea when your time is going to be up. Nobody does, you know, know, and so there's a lot of things that I can teach people to help them plan for the worst should it happen, no matter when, you know, whether that to happen very inconveniently at an early age or a later age too.
Speaking of teaching, you also teach death doulas, correct?
I do, yes, I do. I train death doulas. So most death doulas are non-medical. Death doula, by trade, the name, it's a non-medical thing. So in working as a death doula, I'm not practicing medicine or acting as a nurse. But because I am a nurse and I have all of this knowledge, I'm just able to identify where death doulas need a little bit more help. So it was, quickly in trying to meet people and just, networking with other death doulas, people were looking for help, like I don't really know where to go from here, or how do I really start my own business? And then I was able to identify also there's, a lack of education regarding hospice. Okay, so death doulas and hospice are very different. We work in the same realm, but we don't step on each other's toes. We work side by side, but death doulas need to know fully what hospice is. They need to know that. They need to understand that, what they can do, what they can't do, what they should be doing, so that they can best help their family, their clients, their people, whoever it is that they're trying to help. And then also, there's not a lot of knowledge around the medical aspect of dying with death doulas because it is non-medical by trade. But it's my belief that if you could understand a little bit more about what's happening as the body's dying, that just will make a death doula better. So I started offering education surrounding these things. How do you open your own company as a death doula? How do you market yourself? How do you get clients? How to learn about hospice, how to work with them proactively. Because sometimes hospice can be nervous about death doulas because they don't really know what we are either. So for
just like labor and delivery is nervous about birth doulas.
There you go. So for me, it was very important for me to get in front of hospice because I'm an advocate for hospice. I know everything they do, and I've seen people die with and without hospice, and it is not ever my choice to see somebody die without hospice. So I wanted to get in front of them right away and make sure they know, I'm here and I'm working in this realm, but I'm pro-hospice. I'm working together with you. We're friends. So I do have a great relationship with most of the hospice companies in the area for that reason. But yeah, so these are the trainings that I've started offering death doulas, and I am actually in the process of opening my own death doula training program. My hope is to have a virtual program and an in-person program that would have some hands-on training, which would be really great.
Wow, that's great. Yeah. And what you said about getting in front of hospice, so you're also trying to have a drama-free death. Which sounds like a silly term, but I make up a lot of silly terms on this show. But that's true. A lot of times, the best and worst of families all come out during the same time. And sometimes that spills over into the caregivers, and the caregivers are impacted. And I saw this a lot, both in the ICU and often pre and post-surgical. So that does make a sense, not even peacekeeping, but peacemaking, since there is a difference between those two terms.
There is definitely, yes. And I do hospice and I work really well together. I mean, we really complement each other well. Since I'm a nurse and I'm usually working with nurses in hospice, that obviously, what a nurse-to-nurse relationship's like. You can kind of talk nurse lingo to another nurse, and so, we work great together. But you're right, it is great for us to be able to work together not only with the client, but in all of the drama that can be surrounded with a death. That is kind of part of my goal, is to reduce as much drama as possible. And a lot of times I find that drama surrounding deaths comes from a lack of knowledge of knowing what people want, right? So maybe the medical POA has made a choice, but everybody else doesn't agree. But if there was a conversation beforehand, so that everybody understood, this is what I want, then when the medical POA makes that choice, maybe it wouldn't be such a drama thing. So I'm just a really big advocate for, let's not only plan for everything, but let's talk to everyone about it. Because just a little conversation can really prevent so much of that drama. I know you've seen that, fighting at the end of life and siblings and all of this stuff, and I try so hard to make sure there's none of that.
Because again, what we're talking about is a good death, good grief. Because we know there are complicated griefs in life where things didn't go the way that you wanted, and it's hard to get over it, rather than a clean grief, which I suppose I can define better, but then we'll go off on another tangent.
We will, yes.
But it still is the idea of that sometimes when people die, there's rifts afterwards, because with all that sorrow, a brother didn't act the way that they should have, or the sister made this decision. And so it makes the grief process so much more difficult. So, that depends on cultures too. Some cultures are better or worse, or have different philosophies of it. I mean, again, here in America, like, nobody wants to die. Everyone wants to spend all their money not dying. It's a very strange thing.
Right.
And so you have to be culturally sensitive, while at the same time, I guess you're also saying, like, no, we have to kind of fight against the way this usually goes, because it's not working for anyone.
Right. Yeah, usually my clients, the clients that I work with the most, they've gotten a terminal diagnosis, so usually cancer. So they kind of bring me in knowing, you know, they've been given this timeline or whatever it is. And so I'm kind of the starter point where it's like, all right, well, I guess I got to start exploring what could or couldn't happen. And a lot of it is kind of acceptance, getting them to accept things, you know. Sometimes people can repeat back to me stuff that the doctor said to them, but I can tell that they don't really understand what that meant, you know, so it's kind of like working through that. Now, what I hear the doctor saying is, you know, maybe there isn't any more treatments that are going to work for this, or, you know, whatever. Sometimes people really just need help with, you know, working through all of that.
Sure, absolutely. Okay. So is there a type of client that isn't a good fit for you, or a type of patient that really a death doula isn't really that useful?
Honestly, no. I can't picture a scenario where I wouldn't be able to be helpful. I do know that some, you know, death doulas are different. Like, everybody kind of does their own thing.
Sure.
And some people do choose to not work with certain illnesses for certain reasons. Some people don't want to work with children, understandably. I personally have not ever worked with a child. I would try it, but I don't know how. You know, I would have to see how that would go, just because I've never done it. You know, I've always only worked with adults, but I've worked with clients that were in their 20s, their 30s, 40s, 50s, all the way up to into their hundreds.
Wow.
You know, I'm really great in situations where people are aging out, because I have a lot of nursing experience there, but I find that I can be extraordinarily helpful in, you know, somebody's gotten a cancer diagnosis and, you know, now it's just jarring for everybody. Most of my clients are younger, they've got children, they've got a spouse, you know, so there's all of these different aspects to the fact that now, you know, their lifeline is a little shorter than they thought.
Right. And that's a lot of the times where we, the two of us, can work together, and where mental health comes in, because it is important to have counseling as you're working through that. And not only for, a lot of times we, again, the way the Western medicine works, it's like, okay, let's give this person all these resources. But I'm like, well, no, wait, they live in a family system. We're not just treating one person here. Let's make sure that everyone has the counseling that they need, the psychiatry that they need.
Yeah.
And I'm not saying that, hey, you're going to die, let's give everybody Zoloft. But what I am saying is, let's look at what the needs are, get down to really what the root causes are, and what each person really needs, and treat it. Not in a extensive way where you're spending your last days talking to a stranger about your childhood, honestly. But still, like, what are these threads that have never been pulled that need to be, or what is still missing, or what do we need to have some closure on?
Right. And not only, like you said, it's for the whole family, right? So sometimes the dying person themselves can be really at ease with what's happening, like they understand, but maybe they've got a spouse and a young child, and the spouse and the young child are really, really, really struggling. So sometimes it's those people that I'm like, you know, a young girl who's going to lose her mom, you know, maybe we could preemptively throw her into some counseling to kind of, you know, what's this going to look like, and just to kind of get her prepared. But I definitely am all about that, and working through that, and trying to keep people as healthy as possible. You know, death is always so sad. Everybody says that death is so sad, right? But for the person who dies, it's usually not sad for them. It's usually pretty comfortable for them if we're working together. It's only sad for the people that are left, you know? So I try to do everything I can to make them remember it in more of like a beautiful and tender type way, as opposed to like a sad and sorrowful type of situation.
Right. Yeah, like that movie, is it Inside Out, where the girl's finally growing enough that she has memories that are both happy and sad, and she doesn't know what to do with them.
Yes, I love that.
So you're saying if we can make death a bittersweet experience, it's still bitter. Like, there's no disguising it.
Yes.
But if there can be some sweetness in it, then it's not something where the survivors are like, no, I don't want to think about mom's death. I don't want to remember this. It's something that can be treasured and kind of placed where it needs to be, honestly, in their brains.
Yeah, absolutely. I mean, imagine if you were a kid, you were younger, and you were losing a parent. I mean, that's so hard. But, you know, imagine if you look back at it and are able to picture it being beautiful, or more of a celebration, as opposed to just everybody moping around and so sad. I also like to help people do stuff like that. Like, let's have a celebration of life while you're here.
So you can enjoy it too.
Absolutely. I help people write their obituaries, right? Like, nobody likes writing an obituary. So like, let's just do it. If we know that it's coming up, like, let's get that thing written and get it out of the way, and then your family doesn't have to worry about it. But also I like to work on legacy projects with my clients. So they say everyone dies 2 deaths, once when you die and once when you're spoken of for the last time. So what type of legacy do you want to leave behind for those that you're leaving behind? So like I mentioned, a lot of my people are dying younger than they probably thought they would be. So they have family that they're leaving behind. So we kind of work together to create something tangible that I can give to their people after they're gone.
Wow.
And so, you know, not only do they have these memories, great memories, hopefully, but also, you know, something that their person actually made for them that they can kind of hold on to forever. So
that's great.
Yeah.
And I think too, one thing you're trying to do is find these little pockets of joy, even in a difficult situation.
Yeah, absolutely.
I mean, I'm not saying that you have to write in the obituary, she was actually a superhero. This is the only time that we're admitting what her powers were.
Yeah.
But so it doesn't have to be ridiculous, obviously, but where you can find pockets of joy or humor.
Yeah. Yeah, I'm definitely a humor girl. So I will try to slip humor in there all along the way and keep people laughing and keep it lighthearted and fun. I mean, I see death differently than most people in the world do. So, you know, most people hear the word death and they clam up and they get nervous and they get anxious. But for me, I know this is what I'm supposed to do. I'm like meant to do this, and I'm good at this. And I know that when I work with somebody, even though I lose them at the end, like it's almost a little rewarding because I know I did a good job. You know, I lost them, but I lost them in a beautiful way, and it was great for them and for their people. I always stay in contact with all of the family members because I kind of become a member of the family. You know, someone dying is a really, really intimate thing. And so to kind of let me into their moment like that, I'm always grateful. But also I do really kind of build bonds with people and become like a member of the family. So I do keep in touch with everybody afterwards just to kind of make sure that everything's okay. You know, and if I do, I am absolutely not a counselor, so we can talk things out, but if I feel like somebody needs a grief counselor or needs more than what I can offer, I always kind of, you know, have great people to fish them out to.
Right, just like we're not death doulas at Ascend, so we'll send them to you. And again, it is a lot about the people left behind because so much of our culture is let's do everything for dad, and then, well, what are you doing for yourselves? And the death is easier for the person if everyone else is being taken care of, if they're tuned up. I mean, we do that with surgeries. When I have one of my patients who's going to have surgery, I'm like, okay, let's come in for ketamine treatment, either like right before or right after. Let's make this in such a way, because we deal with addiction too. I have patients who are like, I don't want to take any narcotics after surgery. And so by building a safety net, then they can go into the surgery more comfortable. Because a lot of times with my patients, I'll make them laugh right before they fall asleep, and they wake up much better too. So it doesn't even take huge things, but if you can just tweak little details, as you said, death itself in some cases is not beautiful, but if you can tweak some of those details, then you end up with a much better result for sure.
Yeah, I totally agree.
That's great. So if somebody wants to become a death doula, is there any certification or experience that they need?
Yeah, so there are death doula training programs, and there's training and then there's a certification program that you can go through as well. There's many different schools out there. So I personally like to recommend Doula Givers, if anybody likes that. That one is run by a nurse, a registered nurse, and I think that she does a really good job at diving into the medical stuff that people really need to know. But I also am trying to open my own school. So I mean, if anyone's looking to get into it right away, definitely, you know, check out Doula Givers. They're great. I hope to be up and running after the first of the year. So, you know, if it's not something where someone's in a hurry, they can always just reach out to me. I have a list of people that I'm going to get a hold of as soon as it's opened and get them signed up and all of that. So.
Right. And I asked about the certification too, because it can be so challenging in today's world of marketing and social media. To find out, like, well, who's actually the person that I need for this? I mean, that's honestly one reason why I do these shows. It's as simple as some people will listen to me and be like, oh, that guy's a little weird. I don't want to go to Ascend. It's perfectly fine. We both save ourselves some time and effort, and you might have saved yourself a copay. That's great. But at the same time, it is, you know, you do need to hear testimonials. You do need to find a personal touch. Some of it is aligning. And again, death is so personal. The spiritual aspects of how we deal with death are so complicated in this country because, you know, it's this mix between death doulas and chaplains and hospice, and how do they all fit, and how do we like look back at this person's life? So it can be very complex.
Yeah, it definitely can. And you're right. I feel like a lot of times people just don't even know who they need. Like, I think that in end of life situations, everyone's panicked and stressed and there's all this stuff going on, but it's like, who do I even call? Who's going to help me, you know?
Right.
So that's why I'm out here being noisy and letting everybody know I'm the one. You can give me a call, I'll help. And if I can't, I'll find someone else who can.
Right. And I think in these cases too, you have to push through the discomfort. I mean, it's the same with mental health. A lot of times people are like, oh wait, what's going on? There's a stigma with it.
Yeah.
And it's one of those things where it's like, okay, now it's time to talk about it.
So I always like to say, choose your hard, right? So people are like, ew, I can't talk to my mom about when she's gonna die. That's so hard. It is super hard, you know, to talk to your mom about that, or as a mom to talk to your kids about that. But you know what's even harder is when you don't talk about it and then you die.
Absolutely.
Then that's even harder. So, you know, you really get the choice to choose to have these hard conversations, and I really implore people to do it because it's much less hard than not doing it in the end.
Mm-hmm. No, absolutely. And again, some of that's cultural. Like in Greek culture, I think my mom probably started talking about her death as soon as I came out of the womb at age 30. It's just kind of a thing that Greek women do. They just talk about how they're going to die all the time. But at the same time, a lot of times it's like, okay, well, let's go a level deeper. Like, how do you want to die?
Yeah.
And what do you want to see? Because a lot of times we talk about like, well, this was, you know, the final wish of this person. And there's a part in My Big Fat Greek Wedding 3 where the woman's like, this is what my dad wanted. And her brother was like, you know, Dad wanted a lot of things. And he asks you for stuff all the time. This is just one of the things that he wanted.
Right.
So there is, I do this with the ketamine infusions a lot when patients are using them to kind of get over a death of like, let's put this in a place of honor, this memory, but let's put it where it belongs. Let's not put it in the forefront of your brain where the way you see the world from now on is through this filter of this trauma or this loss. At the same time, let's not forget it where it's churning up emotions and reactions that you don't understand because it's in your subconscious. Right. Let's just put it in a place of honor where it belongs, put it in your memories, almost shelve it, and then move on with your life. So it's a place of honor, it's a place that you remember, and as you said, with bittersweet memories, but at the same time, it's not a place where it's continual pain or continual like, let's talk about this to everyone that we see, or this is who I am now.
Right. Yeah, no, that's very smart to kind of like shelve it, like you said. Like it's there, it's going to be there, it's never going to go away. But you got to figure out how to make it fit and still be you, right?
Absolutely.
Yeah.
Well, thanks for being on the show today. This
Thanks
was great.
for having me. I love it. This was fun.
All right. So if anyone wants to reach you, it's your website again is.
You can find me. It's caseygaconio.com. You'll probably have to look up the spelling, but that's okay. Also on all social media, you can find me at Death Doula Casey. So Facebook, Instagram, TikTok, YouTube. You can find me anywhere, and I've got lots of content out there. So please take a look if you want.
Absolutely. And for us, it's ascenthealthcenter.com. So thanks for watching.
Bye.
You are watching WCTV, Wadsworth Community Television.